The last thing you want when you've just been diagnosed with a cancer is to have all of the administrative burden associated with actually getting your treatment. If a patient can come in, consult with their doctor, go straight through for treatment, have the treatment, and not have to worry about filling forms, securing funding for treatment, making sure their medications arrive on time. If we can eliminate all of those in terms of that pathway for the patient, that's going to relieve stress for the patient and make their journey as seamless as possible. One of the weaknesses of software systems I've used in the past is that software gets designed by software engineers and the system is thrust upon the clinician. I think the system is different because we did the opposite. We allowed clinicians to develop system. We had clinical nursing staff involvement in terms of the process flow within the chemotherapy suite, because unless you know what happens on the ground, you don't know how that system is going to help or hinder you in your daily activity. It's critical that for an oncology patient, they stay on schedule with their treatment. Bringing the pharmacy in is a natural solution, because the more you coordinate patient care, the better your treatment outcome is going to be, the better the journey is for the patient.
So Dis-Chem's role in creating cancer care more accessible is through our logistics of creating a mini Dis-Chem Oncology at as many sites as we possibly can. We staff the pharmacy with applicable staff. So in most cases, it's a pharmacist that is trained in oncology pharmacy. So a patient has a one-stop shop essentially in terms of accessing their medication. So once they come and see the doctor, once their treatment plan is authorized, they have access to one of our pharmacies on site. And creating access through that with the patient is what alleviates a lot of anxiety. The oncology solution helps to improve and standardize documentation by creating a single technology platform all healthcare providers in the journey of a patient is able to access.
I think the collaboration in terms of this partnership is really essential in terms of improving the patient experience. And that's ultimately what we're focused on.
Creating that accessibility, insight into all spheres of a patient's journey is what Altron HealthTech has brought together in HealthONE. Having that access to information is what triggers every other operation in our business, from procurement to how we staff, how we run our shifts, how we organize with our logistics and supply chain partners. So just by having that insight, and that just creates a lot more efficiency in terms of the patient journey. They see this seamless integration between a multitude of different services in the solution, but there's one version of the truth that then carries through.
Where the major potential of the HealthONE ecosystem is in future use of artificial intelligence to drive improvement in patient outcomes.